Sydney.
Hi.
Welcome in today.
Thank you.
My name is Dr. C. I'm going to be taking a look at you. I see here that you're in for your new patient exam.
That's correct.
It's great to meet you. I'm going to go ahead and start off by confirming your first name and your date of birth.
Okay. Sydney, May 10th, 1996.
Okay, great. Is there anything in particular that brings you in today, Sydney, or you're just switching doctors?
Just switching doctors. New check-in.
Okay, sounds good. I'm just going to go over some basic health questions, make sure we're all up to speed. Do you have any allergies?
No.
Okay. Have you had any major surgeries within the last year?
No.
Do you wear contacts or glasses?
I do not.
Okay. Have you been out of the country in the last 6 months?
No.
Do you have any pre-existing health conditions that I should be aware of that you want to talk about today?
None that I can think of.
Okay, sounds good. Okay, I'm just going to go ahead and dive right into our new patient exam then. I'm first going to go ahead by checking your vitals. I'm going to start off with blood pressure.
Okay.
Is this an okay arm to do the blood pressure test on?
That's great.
I love your tattoo.
Thank you.
Okay, Sydney, we do have a normal reading today, which is a good sign.
Great.
Just going to go ahead and slide this on. I'm going to go ahead and mark down the result in our chart here. Now I'm going to go ahead and take a look at your face. First, I'll go ahead and put on these gloves. Okay, then first I'm going to begin by palpating your face. I'm going to reach up and tuck your beautiful hair behind your ears. I'm going to begin with some gentle palpations. Feeling the musculature of the face, as well as the bone structure of the skin. Making sure that there are no bumps or lumps beneath the surface of the skin. Your neck, making sure that there are no signs of swollen lymph nodes, kind of inflammation along the neck. Do you have any issues swallowing?
No.
Any issues with any headaches or migraines?
I do get migraines.
Okay. Have you ever taken medication for migraines?
I used to.
Okay. Have If that continues to be an issue, let me know. Maybe we can get you on some new medication.
Right.
Now I'm going to go ahead and move on now. Okay, Sydney, go ahead and close your eyes and relax. I'm just going to begin by feeling the bone structure of your face with my hammer tool. Your reflexes do seem to be in check, nothing to be concerned about. Can you go ahead and smile for me? And frown. I'm going to put my fingers here, try and raise your eyebrows. Okay. Now I'm going to go ahead and move on to taking a look at your ears. Go ahead and face forward. If you could turn your head a bit to the left for me, perfect. I'm going to begin by taking a look. Okay, great. I don't see any signs of any wax buildup. There's no redness, no dripping, no lesions. Ears are looking healthy. I'm going to move on to your left side now. Okay, great. I don't see any signs of any swelling, no lesions, bumps, or drainage. Things looking healthy. Okay, Sydney, now I'm going to test your hearing with the tuning fork that I have here. I'm going to ask you to face straight ahead and to close your eyes. I'm going to begin by using the tuning fork to place some vibrations by your ears. You're just going to tell me which sound is louder, position 1 or position 2.
Okay.
I'm going to gently tuck your hair back here really quick.
Thank you.
Position 1 and position 2.
Position 1.
Yep. Position 1 and position 2.
Position 2.
Position 1 and position 2.
Position 1.
Position 1 and position 2.
2.
Yep. Now you're going to keep your eyes closed and you're going to let me know whether you hear this sound from your right ear or your left ear.
Right. Right. Left. Right. Left. Right. Left. Left. Right.
Great. Now I'm going to go ahead and take a look at your nose. If you wouldn't mind tipping your head back for me, I'm just going to go ahead and insert my tool and take a look. Okay, great. No signs of excessive redness or swelling. Tissue looks very healthy. I'm going to move on to your other nostril. Everything looks healthy and vibrant. No signs of any tearing, no redness. Have you noticed any problems with your sense of taste or smell?
No.
Okay. Sydney, now we're going to move on to your sense of smell. You can go ahead and close your eyes. I'm going to hold up this bottle to your nose, and you're just going to tell me what it is that you smell. Go ahead and inhale.
Lavender.
Yep. Perfect. Okay, I'm going to take a look at your mouth, Sydney. I have my tongue depressor here. I'm going to ask you to stick out your tongue and say ah. Okay, great. Everything's looking healthy. No signs of redness, swelling. Go ahead and put your tongue in your right cheek and your left cheek. Go ahead and open your mouth and stick your tongue to the roof of your mouth and draw it out for me. Okay, great. Now I'm going to go ahead and test your sense of taste. Go ahead and close your eyes and stick out your tongue. I'm just going to place a dropper onto it. And there we go. What is it that you taste?
Lemon.
Yep. Great job. We're just going to do one more of these. Go ahead and stick out your tongue. And here we go. What is it that you taste?
Mint.
Great. Now I'm going to go ahead and move on to a sensory test of the skin of your face. You're going to close your eyes and I'm going to press an object into your skin. You're just going to let me know if that object that you feel is cold or if that object is warm.
Mm.
This is an example of what cold will feel like.
Okay.
And this is warm.
Mm. Cold. Cold.
Mm.
Warm.
Mm.
Warm. Warm. Cold. Cold. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. Cold. Cold.
Okay. Lovely. Now we are going to do a sharp or a dull test. It's going to be the same thing. You're just going to let me know if that object that you feel is sharp or if that object is dull. Go ahead and close your eyes. This is what sharp will feel like. And this is what dull will feel like.
Mm. Sharp. Dull. Sharp.
Mm.
Dull. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. 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 Sharp.
Okay, lovely. Now I'm going to take a look at your eyes. Go ahead and stare straight ahead. I'm going to be looking at how your pupils react to light. Okay, nice pupil dilation. I'm just going to have you, I'm going to have your head remain constant, steady, and I'm going to have your eyes follow my fingertips. Okay, great. Now I'm going to ask you to extend your right hand here, and I'm going to have you hold this chart that we have here. Go ahead and extend all the way. And with your left hand, I'm going to have you cover your left eye. Okay. Would you mind reading this row for me, starting at the left and moving towards the right?
D, H, J, B, S.
Perfect. Now I'm going to have you read this row, starting from the right and moving towards the left.
O, C, T, P, E.
Okay, lovely. And what's this letter?
E.
What color is this?
Red.
Okay. Now I'm going to have you reverse, so you can go ahead and switch hands and switch eyes. Perfect. Go ahead and extend all the way. Go ahead and read this row, starting at the right and moving towards the left.
H, P, F.
Great. Now I'm going to have you read this bottom row, starting at the left and moving towards the right.
L, T, F, P, H.
Okay. And what letter is this?
F.
And what color is this?
Green.
Great. Your eyes are seeming perfectly normal, perfectly healthy. Before we move on to your abdomen, I'm just going to finish up here by a scalp assessment. If you wouldn't mind bowing your head a bit for me, I'm just going to begin by gently palpating the scalp, feeling for any kind of bumps or lesions. I don't feel any causes for distress. Does this cause you any pain at all?
No.
Okay, your hair is looking very healthy as well as your scalp. Now I'm going to go ahead and ask for you to lay down, and we are going to take a look at your abdomen.
Alright.
Alright, Sydney, go ahead, just continue relaxing. I'm going to begin by listening to noises of your stomach, making sure everything sounds normal. Okay, everything is sounding perfectly normal. Also, I'm just going to palpate the skin here. Let me know if this causes you any kinds of pain or discomfort. Okay, everything is feeling and sounding normal. I am going to go ahead and move on to your feet.
Okay.
Okay, Sydney, go ahead and keep relaxing. I'm going to begin by doing a visual inspection of your feet. Make sure there's no hidden signs of any fungus, any kind of infections. Everything is looking good. The skin is looking perfectly healthy. I'm going to go ahead and palpate the skin, feeling for any kinds of bumps or lesions beneath the skin. Making sure we have full flexibility in the toes. Does this cause you any pain?
No.
Just gonna be moving the joints in our toes to make sure we have full range of motion. I am going to be conducting a brief sharp or dull test on the skin of our feet just to make sure everything is intact. Okay, and let me know if the sensation that you feel is sharp or if that sensation is dull.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay, great. Now I'm going to be conducting a warm or cold test. Let me know if the sensation that you feel is warm or if that sensation is cold.
Warm. Cold. Warm. Warm. Cold. Cold. Cold.
all done with our examination today. I'm just going to have you sit up and then we can go over the results.
All right.
Okay, Sydney, I'm just wrapping everything up here. I put everything into your chart that we discussed today, that we went over. You definitely are very vibrant, young, and healthy. I will give you our contact information as well if you don't have it already, so that you can feel comfortable contacting us if you have any kind of emergency, any kind of discomfort. You can always schedule an appointment, or we also have a patient portal that you can feel free to message me at any time.
Thank you so much.
Thank you so much. I hope that you continue to be happy and healthy, and hopefully everything goes great for you.
Thank you.
Thank you so much.